Again, thank you so much for joining us here on Idaho Today. You know, robotic surgery is the most advanced form of minimally invasive surgery available today. And Saint Alphonsus is proud to offer the most experienced and comprehensive robotics program in the state of Idaho. We actually had the chance to check out one of their amazing machines firsthand, and we talked to Dr. Chris Riesing to see exactly how it works. Check it out. Dr. Riesing, we are here in the OR. What makes this OR so unique?
This is a robotics operating room, so as you can see the Da Vinci robots behind us and the console that the surgeon works at is behind this room. So this room has been dedicated to robotic surgery.
Okay, and then it's called robotic surgery, but the physician is still the one doing all the work. Can you explain that?
Yes. So the way a patient experiences this, they come into the room, they're put asleep by anesthesia. Then our team helps prepare them for surgery, including prep and drape. And then the surgeon and the team get access to the abdomen or the chest or wherever the surgery is going to take place with small ports. These are like metal tubes. And through those tubes, they connect to the arms of the robot. And instruments go through these arms that are controlled by the console over in the corner, and that's where I sit to do the surgery. So the team is always by the patient, surgeons with the patient initially and at the end of the operation, but every movement of this device is controlled by the surgeon at the console.
And what are the benefits of robotic surgery?
You know, it's been a big paradigm shift for patients because we're able to do larger operations, most of the time with experienced hands faster, with less bleeding, and for cancer surgeries, a better lymph node harvest, which impacts survival. And we're seeing shorter recoveries and quicker return to work and life.
Wow. Okay, so pretty profound. And you had mentioned cancer surgery. So what are the type of procedures that you would apply robotic surgery to?
You know, really almost anything where there's a cavity to work in, you can apply robotics to. So from my standpoint, I do esophagus, stomach, and diaphragm surgery mostly. So we take care of esophageal cancers in the chest and abdomen, stomach cancers. Any abdominal case can be done with the robotic equipment, so colon, colorectal surgery, small intestine, hernias, all those things are applicable.
Wow, okay, and what type of training does a surgeon have to have in order to utilize a tool like this?
Nowadays, most of the surgery residencies and fellowships have specific Da Vinci training built into their program because it's become such a common tool to use. So there are many surgeons that have been using this tool for 20, 25 years.
Wow, okay, so it's been around for a couple decades.
Yeah.
Okay, and what is the benefit for you as a surgeon taking advantage of this type of technology?
It's huge. When I was doing all my surgeries laparoscopically, I would stand at the bedside and lean over like this over the patient to hold instruments. So all my weight is on my right ankle, right hip, right back, and my arms and wrists are tilted in unnatural ways, and over case after case, year after year, you get arthritis. So it decreases the length of life of a surgeon. So moving over to a console where you can sit with good posture, look in a viewfinder, and control 4 arms instead of just having 2 leads to an extended life with less arthritis.
And imagine too, with your procedure itself though, allowing you to have maybe a little more accuracy, because if you're constantly having to hold yourself, that's got to put strain on you as well.
Absolutely.
Right?
Yeah.
So just kind of overall a great benefit.
Right.
Wow.
There's been a lot of naysayers about robotics. Those that were very good at laparoscopy sometimes think there's not a role for it, but honestly, you have an amazing tool and you put it in a very skilled surgeon's hands and they're going to be able to even do more with it. So yeah, it's increased the technical capabilities of what we can do exponentially.
Wow, well said. Where can viewers go to learn more about robotic surgery?
SaintAlphonsus.org, and go to robotics and you'll see our program and all our surgeons. One more comment about what differentiates us,
Yes.
Right? So what differentiates our surgical program and our surgeons is all of them that we recruit are skilled in robotics and laparoscopy, but because we're recruiting to a team approach, we have a collaboration that's very unique. So our teams support each other in the development of our skills over time. So we have surgical oncologists, colorectal surgeons, general surgeons, and many other specialties represented, but we're all always helping each other, and by helping each other, we improve our skills and our patient care. So that makes us unique and a standout.
And one more time, where can people go to learn more?
SaintAlphonsus.org, robotics.